question goes to that heart from the audience is, would every doctor be able to prescribe, or would there be special prescribing doctors under the South Dakota law?
Any qualified physician, according to the law, which basically is almost any medical doctor. It's in here, I can't find it right now, but it's a regular doctor. Any regular doctor that chooses to do so after consulting with the patient and having a prior history with that patient and having had actual visits with them. Again, we don't have dispensaries here. Montana has, in essence, dispensaries. They're not going to be here. So you can't just walk in and say, hi, I have a pain, I want marijuana, and have somebody who is working for the dispensary as a doctor, even though the qualified doctor, say, okay, here it is. But I have to point out, as you mentioned, pain is kind of hard to say. It's kind of hard for anyone, even a doctor, to tell you in the end, absence a disease, which most of this is about, a long-term disease, a serious illness, saying I have pain, even if it is just from an injury. They will prescribe without anybody questioning them because they believe the patient. A lot of these very serious, hard to take medications that they're allowed to prescribe, I don't see the difference. If the doctor believes that it has medicinal value and they're permitted to do so, then they'll decide what they think is best for the patient. If they think that marijuana is better because it does help cure the pain, it doesn't have the side effects, doesn't have to have the liver checked every 30 days as OxyContin and many of these other heavy-duty drugs do, then maybe it's a better route to go. I don't really see the difference here.
I go back to that the majority of the South Dakota State Medical Association has spoken out against the Initiative 13. They're firmly in opposition to Initiative 13. The doctors, they know best. They are the ones that have studied. They're pain management specialists. They know what works for pain, what works for this sickness, that sickness. And they say medical marijuana is not a viable option. Smoking marijuana is not a viable option for treating any ailment. And that's what the National Multiple Sclerosis Society, the American Cancer Society has been around for years, the Glaucoma Society, and again, I go to the State Medical Association. They say it's not medicine. So until it reaches the bar of medicine, I just don't know why we'd even consider it. Smoking anything when we want to invoke, yes, we want to take away the ability to smoke a cigarette, but in Vote 13, we want to give you a marijuana cigarette. It's very complicated.
Well, I'm not sure about the comparison because I don't know, of course, every doctor in South Dakota, but I doubt that the South Dakota Medical Association speaks for the majority of doctors. I don't know how many doctors there are in the entire United States, but the largest medical association in the country is the American Medical Association. They say they represent 250,000 doctors. I think there are a few more than that in the country. But they say, put it on Schedule 2 as of last November, nearly a year ago. They say, move this to Schedule 2 so we can prescribe it and find out more about it. What the South Dakota Medical Association says is in contrast to the medical associations of a number of states, including states that already have medical marijuana, such as Rhode Island and Massachusetts. Let me read out just a few other statements of endorsement. You have Dr. Jerome Kaiser from the New England Journal of Medicine, the American Academy of Family Physicians, the American Society of Addiction Medicine, National Association for Public Health Policy, the American Academy of HIV Medicine, National Nurses Society, American Nurses Association, and I have 3.5 pages more of medical associations that endorse medical marijuana throughout the country.
Question is, if it is illegal under federal law and we vote yes, is it still not illegal? Trevor?
It's still illegal under federal law, whether you pass an initiative or not. The federal law still stands. It's still an illegal substance, so Schedule 1 is set.
It is still legal under federal law, and unless until somebody finally gets the hint and moves it to Schedule 2 so that the doctors can legally prescribe it. In fact, we have 14 states that believe in the 10th Amendment to the Constitution, that this is a states' rights issue. You have to remember the other prohibition we had in this country, alcohol, required a constitutional amendment voted on by the people of at least 38 states in this country to approve it. They got tired of it because it was a gross failure and caused more problems than it resolved. That's where we are with the war on drugs, which has no constitutional amendment. It was just declared. So under the 10th Amendment, those things not given to the federal government to do by the Constitution, and those things are actually quite few, and it doesn't mention controlling medication, by the way, that the states have a right to make up their own mind and pass a law.
The states can do it, but it's still against federal law. Which the energy should be put towards changing the federal law, not going state by state and having a hodgepodge of laws that don't match. So when we commerce across our country, travel across our country, we aren't at odds with each other. The federal law still stands no matter what the states decide to do.
Another question is, two questions have come in, both kind of addressing the same issue with, does the 6-month waiting period basically, or 6-month association with doctor, basically rule out the ability of somebody to get a marijuana card for a frivolous reason, like such as a skateboard accident or something along that line? Tony?
I'm not sure what frivolous means. In one person's mind as opposed to somebody else. But the obvious intent of the law is this requirement that the doctor know the patient, and know what their problems are, and know whether or not they've had other treatments. It talks about pain medications in particular, saying that in light of the fact that they know they've had other treatments that they don't seem to work, and so then they have the opportunity to prescribe marijuana to see if it will do better for that patient. They might find the better route. I'm not saying everybody that thinks they want it should get it. It's between them and their doctor, and that's one of our phrases, is let the patients and the doctors decide between themselves. The doctor has the expertise. None of us in law enforcement do, either retired or active. It's between the patient and the doctor. The patient knows what's bothering them. In the case of a diagnosed long-term illness, the doctor knows. And they also know whether or not it will be effective. If they've done any recent studies, now if they're still living in the 70s and listening to the things that came out in the 70s from the Institute of Medicine in 1982, even said, this doesn't have any use. In 1999, they said, no, wait a minute. It should be on Schedule 2 because it has medical use. And now the AMA says, yes, it does. Let's put it on Schedule 2. So the major doctor organizations in this country are saying, yes, we need to be able to prescribe it. We need to be able to investigate it further.
The doctors have spoken. The State Medical Association is firmly against in opposition to number 13. They're your doctors, the doctors you see every day. They have spoken. All the other doctors have spoken as well. And I think the AMA statement says, it didn't say medical marijuana was okay. They want to study it more. They didn't say it was okay and they think it's a great medicine. They said it should be studied. Okay? Nobody's going to probably argue that one. Go study it. Study it first. I recommend that. So we can find out what the long-term effects are. Let's study it. But this is not studying when you have a person grow it in his basements and give it out willy-nilly for $350 an ounce. That's not studying. All other medicines that you've probably taken have been studied for years. For them to make it to the stationary store shelf, they've been studied. And the FDA has approved them. So study it. Don't try and force it upon people that don't want it.
Did you have a response?
People who don't want it won't be going to their doctor asking for it. Those that do want it, those that do want it outside of a medical prescription or recommendation, frankly, and you know this as well as I do, you're in law enforcement, can get it anytime they want on the black market, any time of the day or night, in less than an hour. I don't care if it is even here in straightforward South Dakota. It happens. Kids get to their...
You have to take me where you can find that.
I don't know, I don't buy it.
You said you get it anywhere.
There's plenty of it around because most drug seizures, the highest percentage of drug seizures, according to DEA's own stats, 93% of their seizures the last 2 years are marijuana. They don't deal with the other more hazardous drugs. They deal with marijuana. Same true with nationwide. The drug seizures overall, the vast majority of it is marijuana. Why? Because it's easy, because it's everywhere, whether we like it or not. I don't believe in just using it just for the heck of it, but some people do, and they're not running around creating mayhem or killing people as people do on alcohol and some of the other drugs that are illegal. So I think we need to look at this in a little different way of dealing with how we deal with misuse and abuse of drugs.